it, to the best of our knowledge, this was the first study to prospectively evaluate the impact of specific social determinants of health factors on outcomes and access to life-saving therapy for patients with acute myeloid leukemia, allogeneic transplant, which is also the most resource-intensive therapy in hematological malignancies. And so we looked at specific social determinants of health that included a reliance on government assistance programs such as supplemental nutrition and also SSI. We also looked at patients who live below the federal poverty level. We looked at income. So it was a pretty comprehensive research work. And essentially what we found was patients who come from neighborhoods, what we call with high social risk, such as, again, higher reliance on government assistance programs, or with a high proportion of patients with low educational attainment, those patients were not only less likely to receive allogeneic transplant, but they were also more likely to experience mortality or die before the transplant. However, when we look at the outcomes of mortality after transplant, so for the patients who overcome the barriers and actually receive transplant, it appears that the socioeconomic barriers play less of a role for mortality after transplant. Again, highlighting the fact that the patients who can overcome the barriers and make it to the transplant, those barriers have essentially less effect.
We found that surrogates of poverty, this is needing of social support from the government or lower education, both of them indicated increased risk of mortality without transplant and increased limitation to receive the transplant. It seemed like these effects were less if the patient did receive the transplant. We did this study in a unique way. It's a prospective study starting from the time of diagnosis of acute myeloid leukemia, because that will allow us to understand all the factors that could play a role in these outcomes. And by collecting a lot of data from these patients, we ruled out that the limitation in access to transplant is because of medical reasons, because we had all these data and we took into account in the model, but there was an impact of these social factors. So the conclusion of the study is there is a social limitation. Patients who come from neighborhoods with indicators of poverty or lower education really struggle to get to a curative treatment like transplant. And that indicated a form of inequality when we look at these patients, something that we need to change, and we have future and ongoing and future direction to do so. One of them is creating videos and infographics where we provided to patients from underrepresented minorities prepared by patient and physicians also from underrepresented minorities, so can speak to them to increase their chances to access to the transplant. We're also will look in the future into studies to try to explore navigators, paid navigators that can help patients to overcome these social barriers, or even cash money if patients have limitations in travel and coming to the transplant centers. If we give them cash money for a certain amount of time, maybe that would help in removing these barriers, because the goal at the end, if it's a curative treatment, we want to make sure it's available for everyone and not only for a small group of patients.